Hi, I'm Dr. Don Bonner of Personalized Wellness. Today I want to shoot just a little bit of an informational video on what exactly it is that we do here at Personalized Wellness. I think the first thing that's confusing about this kind of medicine is the name. What the heck do you call this? I mean, is it functional medicine? Is it integrative medicine? Is it holistic medicine? My board certifications in anti-aging and regenerative medicine, and my fellowship is in metabolic medicine. So that in itself is confusing. The other thing is, the definitions that I'll throw out. It's a systems-based approach to looking at health, where we take an extended history and we look for the root cause of whatever's causing your symptoms. We treat those root causes to get the patients better. Again, it's a bit confusing. So what I wanted to do today is step back and really go into the whys. Why am I doing this kind of medicine? And really, the first reason why is I find it super exciting. There's a lot of learning. I've learned a tremendous amount. Diet, nutrition, hormones, biochemistry's come back up, organic acid test, specific GI test, small intestinal bacterial overgrowth, all of these different things that I knew nothing about, now all of a sudden I'm learning about. I spent this weekend, Labor Day weekend, I spent hours looking at the Krebs cycle and mitochondrial function and organic acid tests, because you gain so much information from this one test, this one urine test, that I find it fascinating. You take a fatigued patient, you run this organic acid test, and you see that their mitochondrial function is just very poor. So it gives you a place to target therapy and treat. So again, that's super exciting for me. The next take home, the other big reason why, patients get better. They just get better. Now, why do they get better? There's another why. Well, the reason I think they get better is, first and foremost, we allow the body to heal itself. Your bodies have tremendous healing powers if we give it the right building blocks and eliminate certain problems that may have accumulated over a period of time. If we can do those things, your bodies will heal for the most part. It's pretty amazing, and I'm always amazed by how well the body can heal. What I do is I go off this principle, this 80-20 principle. It's just something I came up with. I feel like 80% of patients getting better has to do with this lifestyle portion, this lifestyle medicine that we've talked about in the past several videos. Diet, sleep, exercise, stress management. If we can dial those things in and the patient's on board and is motivated, they will get better. They really will get better, because by giving the body, again, what it needs and eliminating certain things, especially stress, or at least alleviating as much as we can, your bodies will begin to heal. The other 20%, I feel, of patients getting better really comes down to the lab tests that we do. We do some expanded lab tests, expanded lipid panels. I run a fasting leptin level on everybody, fasting insulin level. We do hormone levels, hemoglobin A1C, all of these different biomarkers, homocysteine, GI test, organic acid test. So we do a lot of different tests that give us a lot of information that allow us to target therapy specifically for that patient. So it's much more precision medicine in the sense that we're able to target these specific issues with really the ultimate goal for me, for my patients, would be, after they're feeling better, to not be taking hardly anything at all. That to me would be a tremendous goal. And I'm not here to say that we're going to use the cure word for specific problems, but what I'm saying is it's a win if your if your diabetic patient goes from taking 3 different pills for their diabetes to 1, or they're able to have their insulin dose. To me, that's a win. That patient is getting better and has gotten better. So that's what we're looking for here. We're looking to get patients better, and that's all I do here. So that's what makes me super excited, and I hope you come and check us out. Anyway, check out our next series of videos. They're going to be really good. We're going to go over the neuroendocrine system. I'm super excited about it. I'm putting that together now, and I think it's going to be a really nice series. Our website's www.thewelldoc.com. Again, check it out. We have a free 15-minute phone interview, so check that out, and we'll talk, and you'll tell me what issues you have, and we'll see if this is the right fit for you. So thanks for watching the video.